Hello students, we will discuss a case which is very common, kept as a swelling in the exam clinical side as a oxy short case, and theory also they will ask. Briefly we will discuss what exactly this condition, what this condition is. See that in the scalp there is a swelling, see that, you can see that swelling, very well localized swelling, but hairs are there well occipital region. So it is secretion dermoid cyst. So differential diagnosis is sebaceous cyst. So same thing can happen as a sebaceous cyst. So either secretion dermoid cyst in the scalp or sebaceous cyst. So what are the features and types? It occurs in the line of embryonic fusion. It may get adherent to deeper play part like bone, which will be revealed clinically using finger. So press it and you'll get this one. Skin is free, midline, external angular, lateral, postauricular, midline, external angular, preauricular, postauricular are different sites. External angular is very common here in this site. External angular dermoid is a short note for you. Remember, it occurs here. Bone erosion is very typical, just above the eyebrow, lateral aspect. CT part is a must. Commonly it's in head, CT head is a must because bone erosion has not occurred. Unlike sebaceous cyst is only skin and subcutaneous tissue, whereas dermoid cyst is the deeper plane. Skin is free clinically, so it is in the deeper plane. It may get eroded into the skull, outer table, maybe sometimes inner table. So different types are there. It's a secretion dermoid actually. So treatment is excision under GA. That point is very important. Don't do it under local. If it is sebaceous cyst, you do it under local, but not dermoid cyst because it is adherent in the deeper plane. You will find difficult. Always opt for general anesthesia full-fledged. Then if it is extending down into the deeper plane, take neurosurgeon's help. If it is going into the meninges, sometimes both tables, take neurosurgeon's help and do a formal job to excise it completely. That is important. So CT scan is very important even you suspect dermoid cyst. Now differential diagnosis sebaceous cyst and maybe other cystic swellings in the skull, also different epidermal cyst and other things can be a differential diagnosis which you can think of. So how to examine swelling in detail, what are the differential diagnoses? You can go through my SRB's clinical methods and surgery with the video lectures of how to examining and SRB's manner of surgery for detailed dermoid, secretion dermoid, different types of dermoid, everything given in there, and how to do surgery for these patients. Also it is given properly, and atlas of tissue approximation, how to do suturing, and my digital lectures through JP publishers. In detail, all topics are there for you undergraduate CBME syllabus and for basics for postgraduate clinical examination, operative surgery, basic specialty urology, neurosurgery, cardiothoracic, X-rays, specimens, instruments, everything is there in detail. You can subscribe for a year so that you have a clear idea about the exam, neet, everything. So students, I hope you understood dermoid cyst basic thing very well. Thank you very much.